Hi, I'm Dr. John Daniels. I'm an orthopedic surgeon at Crystal Lake Orthopedics, and today we're going to talk about anterior hip replacement surgery. I think it's probably time to consider hip replacement surgery if you've had good conservative treatment that hasn't worked for you, whether that be physical therapy, medication, perhaps a hip injection, or even a cane. And if the pain is now affecting your life where you can't do the things you want to do, if you're having trouble sleeping, it's probably time to actually consider a hip replacement. Common symptoms of primary hip pathology would be decreased range of motion of your hip, so difficulty putting your shoes and socks on. The location of the pain for your hip is normally in the front of your hip. A lot of patients think it's around the back side, but it's actually more in the front of the hip radiating toward their knee. And they tend to start limping quite a bit, and those are some of the symptoms that we see. And if you're having many of those symptoms, it's likely that you have a hip problem and probably should see your orthopedic surgeon and have an x-ray. The anterior total hip replacement surgery is a newer procedure. It's been developed several years back, and essentially the incision goes in the front of the hip. It's important because none of the muscles are divided during the procedure. It's a very elegant procedure. Through a small incision, we can directly get to the hip within a matter of minutes. And therefore, by not cutting any of the muscles, we're able to go ahead and do our procedure by replacing the hip, removing the ball, providing the patient with a new artificial joint, but without really disrupting any of their normal anatomy. This is the key to the anterior hip. This is what allows them to recover faster with less pain and a shorter stay in the hospital and typically a shorter overall recovery.